Hey there, during my chats with cancer patients, one topic that comes up a lot is diet. And you know what? Those questions are fantastic, and super important. That's why I'm here today, to dive into some of those questions, and give you clearer answers. Let's break it down together and make sense of it all.
Hi, Dr. Zhang. Can you look at my cancer diagnosis and decide what type of fuel my cancer consumes, and tell me what diets I should eat?
Deciding on a specific diet, based solely on cancer diagnosis and inferred metabolism, isn't feasible. Cancer metabolism is complex, and most cancers can utilize various fuel sources to survive. However, we do know that 3 types of diets, plant-based, ketogenic, and Mediterranean, have shown benefits for cancer patients across different types of cancer. Therefore, I recommend choosing one of these diets based on your preferences. Alternatively, you can rotate between these diets every 4 to 6 months, to ensure a varied nutrient intake and avoid malnutrition.
Hi, Dr. Zhang. I've heard so many conflicting things about sugar and cancer. I'm really confused. Is it important to avoid sugar or not?
I completely understand your confusion, as there is a lot of conflicting information, even within medical literature. Some may advise you to avoid sugar completely, because they told you, cancer cells uptake large amounts of sugar, as seen on PET scans. While this is true, it's essential to note that using PET scans to make dietary recommendations can be misleading. If we were to use a PET scan with an amino acid tag, we would also observe significant uptake of glutamine in most cancers. So, the bottom line is that, while cancer cells can indeed utilize sugars as a fuel source, they can also utilize other nutrients. Removing all sugar from your diet will not eradicate cancer, because cancer cells can change their fuel to glutamine easily. However, it's still advisable to avoid excessive sugar consumption, even if you don't have cancer, for overall health reasons.
Hi, Dr. Zhang. My cancer center nutritionist told me not to worry about sugar. Is that correct?
Cancer cells do have a preference for glucose as a fuel source, so you should not overconsume sugar, particularly refined sugar, but simply eliminating sugar from your diet won't necessarily stop cancer growth. Cancer cells can adapt to utilize other nutrients if glucose is restricted. It's advisable to avoid high glucose diets not only for managing cancer but also for general health purposes, as they can increase the risk of various health issues.
How about high glycemic index foods or high GI food?
GI is not always accurate in reflecting your blood sugar levels. Consuming moderate amounts of high GI foods is acceptable if accompanied by large quantities of vegetables, preferably cooked for easier digestion, which can help mitigate blood sugar spikes. If you have any concerns, you can monitor how high your glucose levels are after the high GI meal. For real-time monitoring of blood sugar levels, you might consider using a continuous glucose monitor like the Lifestyle Glucose Monitor, which provides readings without the need for finger sticks.
Dr. Zhang. How much protein should I eat?
Limit your protein intake to less than 20% of your total daily calories. This recommendation applies across all types of diets, including the ketogenic diet. In fact, consuming more than 20% proteins can make it challenging to achieve a ketogenic state, as excess protein can be converted into glucose through a process called gluconeogenesis, potentially hindering ketosis.
What type of proteins are better, beef, pork, fish, or chicken?
Generally, it's advisable to limit the consumption of red meat like beef or pork to a few times per week and in moderation. When choosing red meat, opt for organic varieties if possible. If organic options aren't feasible, pork may be a slightly better choice. Chicken is a suitable protein source and is generally considered safe to consume. Again, if you can, prefer organic chicken. Fish is also a good protein option, but it's best to avoid consuming fish daily due to the risk of mercury contamination, which is widespread.
I heard that my cancer burns fat. Can I still choose a ketogenic diet?
Yes, you can. As I mentioned earlier, we cannot recommend a particular diet based solely on diagnosis and inferred metabolism, as we don't have a comprehensive understanding of each patient's metabolic profile with current technology. I often hear patients saying to me, "Hi doctor, I have, let's say, ovarian cancer, and it is fed on fat, so I cannot take a ketogenic diet because it is a high-fat diet." These are not very accurate statements, because so far clinical research has not found that ovarian cancer patients have faster cancer growth on a ketogenic diet. Of course, if you choose to avoid ketogenic diets, given the benefit of doubt, I am with it. However, if you choose a keto diet, it's important to ensure you do not have the BRAF mutation. You can determine your mutation status through NGS testing, typically conducted by your oncologist. Of course, you have the option to explore other types of diets mentioned in our discussion as well.
I was told to eat a high-protein diet to increase muscle mass. Is that advisable?
While it may seem intuitive, most cancer patients lose muscle mass due to cancer-related metabolic changes or cachexia. Increasing protein intake may not necessarily reverse this muscle loss, if the underlying cancer or cachexia isn't addressed. Therefore, I don't advocate for high-protein diets. Instead, focus on treating cachexia through appropriate medical interventions.
How often do you check ketones on a ketogenic diet?
In fact, you do not have to test your ketone levels at all to be successful on keto, if you follow the rules of the ketogenic diet. Those rules are avoiding sugar, limiting protein intake to less than 15%, and consuming plenty of fats. Adhering to these guidelines will ensure that you are in a ketogenic state. However, if you're uncertain whether you're following the diet correctly, you may want to check your ketone levels daily for a few days after starting keto, to ensure that you reach nutritional ketosis. After that initial period, checking ketones once a week or so while on the diet can help ensure that you're remaining in ketosis.
I heard glucose ketone index or GKI is very important. Do I have to measure my GKI?
Glucose ketone index, or GKI, is indeed important if you are following the ketogenic diet for epilepsy management. However, if you're on the keto diet as part of cancer management, measuring the glucose ketone index is not necessary. Your cancer cells won't suddenly proliferate because one of your GKI readings is high. However, it's crucial to maintain your ketogenic status consistently. Breaking ketosis, even once, may increase the risk of seizures for individuals managing epilepsy with the ketogenic diet. The bottom line is, you have to measure your GKI frequently if you're on keto for seizures. You don't have to worry about GKI if you are on keto for cancer.
I like eggs. Is it okay to eat eggs?
Eggs are a good source of protein and cholesterol. It's generally fine to include eggs in your diet, but it's advisable to limit your intake to 2 eggs per day. Additionally, when consuming eggs, opt for free-range or organic varieties to minimize concerns related to hormones.
Dr. Zhang, what about milk?
Clinical trials on milk and cancer are conflicting, but most studies suggest a link between high milk intake and an increased risk of cancer. If you enjoy milk, it's advisable to limit your consumption to organic milk. It's not necessary to opt for low-fat varieties. Whole milk, especially organic, is perfectly acceptable. I will limit milk to an 8 ounces glass per day. Ideally, you should consider incorporating more fermented milk products into your diet, such as yogurt or kefir. As for goat milk versus cow milk, the evidence on which is better is inconclusive, so it ultimately comes down to personal preference.
How long can I do water fasting?
It is generally safe to engage in water fasting for less than 3 days without medical supervision. However, it's advisable to consume a small amount of vegetable soup daily during fasting. For fasts exceeding 3 days, it's essential to have lab monitoring and physician supervision to ensure your safety and well-being.
Can I do fasting with chemotherapy?
The data so far suggests that it is generally safe to engage in up to 3 days of water fasting with chemotherapy. This can include fasting 1 day before chemotherapy, on the day of chemotherapy, or 1 day after chemotherapy. Research indicates that fasting during these periods may not only be harmless, but could potentially reduce the side effects of chemotherapy. However, you don't have to do 3 days of water fasting. It's also practical to do just 1 day of water fasting, especially if you're undergoing weekly chemotherapy sessions. In such cases, it may be beneficial to fast on the same day as your chemotherapy treatment. Additionally, intermittent fasting is also an option while undergoing chemotherapy. As always, it's essential to discuss any fasting plans with your healthcare provider before initiating them, especially if you're receiving cancer treatment.
Dr. Zhang, can I take metformin while fasting?
Generally, metformin is safe to take while fasting. If you're on a twice-daily dosage, you can maintain the same dose. However, if you experience any adverse effects, consider reducing the dosage under medical guidance.
Can I do intermittent fasting?
Yes, intermittent fasting is generally safe. You can follow a 1 meal or 2 meal per day schedule.
What type of diets should I avoid?
It's important to focus on healthy eating habits, as we discussed earlier. However, there are some considerations to keep in mind. One crucial point is that certain gene mutations, such as the BRAF mutation, may increase your risk of cancer progression if you're following a ketogenic diet. Therefore, individuals with this mutation may want to avoid the ketogenic diet. Otherwise, sticking to a balanced and nutritious diet that aligns with your preferences and health goals is generally the best approach.
Do you have any other advice for me or patients like me, Dr. Zhang?
Certainly. It's important to avoid all or nothing types of diets, as they may veer towards extreme measures that can be challenging to sustain in the long term. Trade-offs exist for all diets, and what works best can vary from person to person. For instance, while there are many health benefits to adopting a vegan diet, it's essential to recognize that it may leave you deficient in certain crucial vitamins and minerals. If you choose to follow a vegan diet, make sure to supplement with vitamins like B12 or D3 to meet your nutritional needs adequately. However, it's essential to remember that you don't have to adhere strictly to a vegan diet. Finding a balanced eating pattern that suits your preferences and health goals is key.
Thank you for joining us today as we explored the crucial link between diet and cancer. We hope this discussion has shed light on the importance of making informed dietary choices for our overall health and well-being. If you have any further questions or seek additional guidance on this topic, please don't hesitate to reach out to Dr. Zhang or his dedicated team of assistants. They are here to provide you with the support and information you need to navigate this complex issue. Remember, your health is a priority, and by taking proactive steps towards a balanced diet and lifestyle, you can significantly reduce your risk of cancer and other related health concerns. Thank you again for tuning in, and we look forward to continuing this journey towards better health together. Goodbye for now.